Okay, so I have scenario number 3 for my return demonstration. It is Francis Michaud. He is admitted to the hospital for a scheduled cardiac catheterization. My CNA just informed me that he had a preprandial blood glucose of 210. He has a history of hypertension, congestive heart failure, and diabetes. So he has a preprandial glucose of 210, and he also counted all his carbs for that meal for lunch. So I have his orders. I have a sliding scale for his correctional dosing, and then I also have a prandial dosing, but they're both aspart insulin. So for his carbs, he had 71.4 grams of carbohydrates. So on his sliding scale, it's 1 unit of insulin for every 10 grams of carbohydrates. So that would be 7 units of insulin, in addition to his correctional dosing, which his blood glucose was 210. So that would, on his order here, that would be 2 units of insulin. So the 2 units plus the 7 units for the prandial dosing would be 9 units of insulin aspart. It's the same type of insulin, so I'm just going to draw it up in one syringe. So I'm in the med room, so I'm going to get started with that. So I've pulled up my insulin, and I have a 30 unit syringe. I'm using the 30 unit because it's the smallest one that will fit the dose that I need, so I can get the most accurate reading on it and get as close to 9 units as I can. So I'm going to take an alcohol swab, and I'm just going to scrub the top of the insulin vial for 15 seconds, and I'm going to let that dry, and I'm going to take my 30 unit syringe. I'm going to pull up about 9 units of just air. I'm going to put that right in the syringe, flip it up, and I'm going to inject the air, and then draw up 9 units of insulin and pull that out. I'm going to scoop the cap back on before I do anything else. I'm going to get the air out of there. And I don't have any convenient labels, but at this point I would label it with all the appropriate measures. I'm also going to do a med check just kind of as I draw it up here. So once I have it in the syringe, I'm going to look, and that's like before I label it, making sure I have 9 units. It's the right patient, it's the right route, it's the right medication. And once I've labeled it, I'm going to have a second nurse check because this is a high alert medication. So I'm going to have another nurse check, and I'm just going to give them both the syringe and the vial and just ask them what they see. I don't want to like influence them and be like, hey, is this 9 units of insulin? I want to just let them look at it and tell me what they see to make sure I didn't make any mistakes. And we'll assume that they said it was good. So I'm going to do kind of my last check just before I leave the med room. I'm going to do my second med check, make sure that I have the right medication, all the rights of medication administration. I'm also going to make sure I get another alcohol swab, anything else I'm going to need at the bedside, and then I'm going to head into the patient's bedroom.